Wow, so I'm making this video for people who are in stem cells. Stem cell does not balance blood sugar. Stem cell can also lead to your blood sugar can raise. All right? So this is what I'm going to discuss about. I want to clarify for those people who are under stem cell treatment. These are possibilities. Stem cell does not balance blood sugar. Stem cell can also elevate your blood sugar. Are you getting that? So you need to be aware of these things. And stem cell is a treatment, it's a timely treatment. It's not a lifetime treatment. You don't need to stay on it for the rest of your life like drugs. Here is why. Number one, let me start with stem cell elevating your blood sugar. Let's start first know what causes diabetes. Diabetes is caused by the pancreatic failing to produce insulin or glucagon. That can lead to high blood sugar or low blood sugar. Here, according to research, once the pancreas has been attacked by the immune cells, they what called autoimmune reactions. When your immunity reacts and then attacks the pancreas, those cells are going to be affected. Once they affected either of the cell, let me say beta cell or alpha cell. Beta cell produce insulin that lowers blood sugar. Alpha cell produce glucagon that elevates blood sugar. Are getting that? So when we come to stem cell treatment, we are not managing your blood sugar because stem cell is not a treatment that manages diseases. It's a restoration treatment. You are restoring what has been damaged in your body, whether it is a cell or it can be an organ or it can be the system, no matter. It is a restoration. So because our patients has been staying in drugs, so they expect everything to work in the same mode. No, stem cell work in the mode of restoration, not the management. So take an example. If you are diabetic, means you have been using drugs that manages your blood sugar. So when you start on stem cell, you shouldn't stop your drugs. You have to continue. You have to continue managing your blood sugar while the stem cell will be restoring the pancreas. Now, in the pancreas, I remember telling you that we have two types of cells. Number one, we have alpha cell, we have beta cells. Alpha cells produce glucagon that elevates blood sugar. Beta cell produce is far better than it restores faster than the one which is damaged. Are you getting that? The cell which has been actively functioning gets restored before the one which has completely been down. You need to know those points. Now take an example. Once you start stem cell treatment and then you have been having high blood sugar, meaning the alpha cell is active which produce glucagon that elevates blood sugar. What next? Stem cell will repair this cell, will give it energy to start producing at least a higher level of glucagon. So once there is a high level of glucagon produced, are you getting that? Once there is a high level of glucagon produced in their body, means the blood sugar level will have to elevate beyond the normal. Are you getting the point? It will have to elevate beyond the normal. So that means you are going to shake your blood sugar and then you are going to find your blood sugar is high. Moreover, you are in treatment of stem cell. So it has to happen that way. So once there is an increment in your blood sugar level while you're on treatment, that the sign that the cells has started to be restored. But they start with the one which is normal. So after restoration of the alpha cell which has been actively functioning, maybe they will boost it. Then the second, it may take 1, 2, 3, 1 or week. Then the other one which has been totally down will also come to start producing. That's the beta cell will also start producing insulin. Once it start produce insulin, what next? Now your blood sugar will skip from the higher, maybe it has been in 15 or 20. Maybe you started stem cell when it is 10, 8, 11. It goes to 15. Now, once the beta cell also has reached the level of restoration, then it will come back 14, 13, it will come to 10, 8, 9, 7, like that, comes to 6, to normal. So once there's, remember the normal should be 3.5 to 6.5. That's a normal range. So once come back to normal range in that rate, then you are going to continue for another 2 extra months. You have to give yourself another 2 months to make sure that completely your cells has been restored. And then it is your doctor who put you in those medication to declare you diabetic free so that you stop those drugs. Are you getting that? Not the person who has been giving you stem cells. For us, when we are done with our work restoration, now you'll go, because those doctors, they are honest. You know, I don't want to hear this thing people saying that medical doctors want people to fall sick. No, those people are there to find that everyone gets good health. Are you getting that? There is no doctor who wishes a patient to die. No. Doctors find all ways so that we survive. You go match there. Go to them. Let them check you. Let them find out. And then they will put you off the drugs. And that will be official. So some people, because you are tired of drugs, you have started this stem cell, because I've been getting those cases. Some people, they are tired of drugs. They just go off drugs. They continue. The stem cell will not balance your blood sugar because it's not a managing system treatment. It is a healthy system, restoration. So when you're in a restoration, make sure you are managing it. You are managing your glucose. Are you getting that? So that's the tips about stem cell, and I want you to know about that if you're a distributor of any stem cell. And then there are also other related products that accompany stem cell treatment, which helps the kidney, which helps the brain. Are you getting that? Like now, as Yes Global Company, we have Sunrise, that's for restoration. Then we have Colon Guard for the kidney and detox and the digestive system. And then Sunset for the brain. So once you're in stem cell treatment, you need to work upon these 3 organs. Those organs, they are good, and it's vital to make sure you manage them as well. All right? That's why we encourage people to have a healthy triangle. Are you getting that? So this is advice for someone using stem cell. Then there are people who look at diseases as problem. Diseases are not problems. They are challenge. Problem is something that requires money. Once you have money, you can solve it in one day. But when it comes to treatment, you are challenging back these diseases. If you have been with diabetes for 10, 20 years, you can't, even if you have a sack of money and you can afford all the amount they need, you can't reverse it. So the early you start on the stem cell treatment, the time you reduce when you're on the treatment. So you can start today with any package you want, and then you continue, because it will take time. It's not something of 1 week, 1 month. No. Diabetes, to completely get out of your body, it may take you 6 months. Remember, with the stem cell, it's not a lifespan treatment. You use it for a certain period. For example, as Yes Global, according to the stem cell we have, just you need 6 months maximum. Thank you very much for following me. Thank you very much for everything. I remain as Dr. Ulba, Yes Global. I wish you the best. May God bless you. You can also follow me on my TikTok, Healthy Body, Healthy Spirit. May God bless you. My number is 0771966589.